the difference between PMN310 and other antibody really resides in its selectivity for soluble toxic oligomers of amyloid beta, or A-beta for short, and not binding to other forms of A-beta that are not pathogenic, like monomers and plaque. Not all A-beta antibodies are the same, and A-beta is not a single entity. It exists in different forms. And what our presentation is about this year at ADPD is the importance of selectivity of targeting just the right species of A-beta, which is the toxic oligomers, not monomers and not plaque. The current antibodies that have been approved, there's a lot of hope and excitement, and it's great progress. Lecanemab, Aducanumab, which have real efficacy, although it is modest, and unfortunately comes along with an increased risk of brain edema, ARIA-E. So there is room for improvement. And what should that improvement be for the next generation of antibodies? And we believe that it is selectivity. This was really a study to pressure test the concept of selectivity and how it might correlate with clinical outcome. So what we did is a side-by-side comparison of all the different A-beta antibodies that have gone through the clinic, so we know the clinical outcome, and doing a comparison of how well they can bind a toxic oligomer-enriched fraction from Alzheimer's brains, so the real driver of disease. And we tested the binding with and without monomer competition. So basically trying to replicate in vivo in a patient, how well can these different antibodies overcome encountering so many monomers there, which are very abundant, first in the circulation and then again in the brain, so that you have anything left to go and find and bind those toxic oligomers, which are really a rare species. They're present only at picomolar amounts. So we did this in vitro, and what we found, it was really pretty clear cut. So antibodies that are monomer binders, that are non-selective, they bind every form of A-beta, including monomers, like Solanezumab, Gantenerumab, Crenezumab. When they're exposed to monomers, their binding sites become occupied, and they're no longer able to bind toxic oligomers. And that's what we saw. There was zero binding to brain oligomers with these antibodies when monomers were present. Other antibodies that are better at avoiding monomers, like Lecanemab and Aducanumab, Donanemab, those antibodies did retain more binding to the toxic oligomers, even when they were faced with monomer competition. And that's been associated with the positive clinical data that we've seen. And in this side-by-side, very encouraging for us, PMN310 was the least affected by monomer competition, because we do believe from our data and data that's been published on other antibodies that it does have more selectivity. So it's better able to overcome the monomer competition, and also will not be wasted on plaque, will not bind plaque, which should also reduce the risk of ARIA, which is caused by binding to plaque in the parenchyma and in the blood vessels. We've also completed all the formal GLP toxicity studies that are required for an IND submission, investigational new drug application with FDA, to be allowed to conduct a clinical trial. And the safety profile is very good in terms of manufacturing. It's a very well-behaved antibody with good yields. So we are on the cusp of filing the IND, and pending approval from FDA, we would then be able to enter the clinic this year. So we're very excited about this and to see how PMN310 will perform.